Now, medical rounds tonight. If you suffer from sleep apnea and the CPAP machine does not work for you, you will want to hear this interview. Hartford Hospital was one of the first hospitals in the Northeast to offer patients an FDA-approved implantable device to treat moderate to severe obstructive sleep apnea. Surgeons at Hartford Hospital recently implanted their 20th patient. And joining us now to talk more about this is Dr. Moeller, an ear, nose, and throat specialist at Hartford Hospital, to explain more. Good evening, Dr. Moeller. Thanks for being here.
Hi, Denise. Thanks for having me.
First things first, let's explain what obstructive sleep apnea is.
Sure. So obstructive sleep apnea is collapse of the soft tissue of the throat during sleep. This can lead to snoring on the mild end, and on the very severe end can lead to significant drops in patients' oxygen levels and very poor interrupted sleep. So this causes severe daytime fatigue. It's obviously very disruptive to your bed partners, and over the long term can lead to really significant health effects such as congestive heart failure, risk of heart attack, stroke, and other pretty significant conditions.
So if you have this, you want to treat it. And tell us about this new implantable device. How will this help with apnea, and does it even help with snoring?
Sure, good question. So in the past, and still the first-line treatment for sleep apnea is what's called CPAP. CPAP is essentially a mask that blows air into your mouth and nose, stents open the airway, and prevents patients from obstructing at night. Now, CPAP works very well. The problem is upwards of 50% of patients don't tolerate it well. Before the Inspire device, we could offer surgery, which was typically pretty painful and oftentimes didn't work very well. So what the Inspire is sort of akin to a pacemaker for someone with sleep apnea. What it does is it senses every time the patient is taking a breath and sends a gentle stimulation to the tongue to prevent an obstruction from happening with every breath while the patient's sleeping.
Wow. Well, how was it implanted? How does that work?
So it's an outpatient surgery. Surgery typically takes about 3 hours or so. There are 3 separate incisions. There's an incision over the rib cage where the breathing sensor goes. There's a small incision just below the collarbone where the battery and the generator goes. And we make a small incision right under the jaw line. That's where the stimulator that stimulates the nerve goes under the tongue.
Well, this sounds very promising for people who have tried everything. And again, as we said, if the CPAP isn't working, this could be a lifesaver. We all know untreated sleep apnea can cause some very serious problems. We thank you so much, Dr. Moeller, for sharing this with us. And if you'd like to learn more, you can call the number you see on your screen. In the meantime, Dr. Moeller is available to answer your questions live on the Hartford Hospital Facebook page. That starts at 6 o'clock.